Many thanks for staying with us here on News Desk 2. Some more stories now. And a WhatsApp platform group engaged in volunteerism across the country has been undertaking a number of projects to improve the living conditions of citizens, especially the less privileged. Now, in collaboration with UNAIDS, the group is helping with the provision of potable water, quality healthcare and education in many underprivileged communities here in the country. Now, joining me in studio now to tell us more about what this project is about, if I should call it that, a project, is President of Paddies, Franklin Sowa, and Girmay Haile, who is the Country Director of UNAIDS, to tell us much more about this very project. I'm hoping I got the name right, Girmay.
Absolutely.
Okay,
yeah,
that's
perfect.
fine. Okay, that's great. That's great. But let me start off with Franklin. What is Paddies about in the first place, really?
Thank you very much, and good morning to viewers. Paddies is basically a WhatsApp group of friends from professional backgrounds, diverse professional backgrounds to say the least, who believe in one thing, that no matter what you have, no matter how little, you can still make a difference in the lives of people. So we came together about 2 years ago. Last year was the second year. And as part of what we thought we could do as far as WhatsApp is concerned is, of course, have fun a bit, stressful lives, professional work and all that. So we thought that let's just come, have fun on the platform and then leave. But then you look at the capacity of people on the platform, doctors, journalists, senior presenters, some celebrities and all that. We thought that, look, we have the capacity to do a bit more than just having fun and sharing jokes and, the usual typical WhatsApp activities. So then we decided to register Paddies as an NGO. So in the books of Ghana, Paddies is an official group now. So though we are still a WhatsApp group, we are a force to reckon with as far as what we stand or represent is concerned. 2 years ago, we identified a village in Gaist, Girmay. This village is a village that survived on water from a stream, and they had one reservoir. So our understanding was that there are times when there's drought, then the entire village is in crisis because there's totally no water for the village. So Paddies went in, we leveraged the kind of network we have. That's another exciting thing about Paddies, because sometimes not only us by ourselves, but we leverage networks we have. So I have a network somewhere, another Paddy has a network somewhere. So we bring these to bear in times like this. So we spoke to Poly Group and told them that, listen, there is a village in Accra, Greater Accra, that has this challenge. They said, no problem, we'll come on board. So we bought a 10,000 gallon size poly tank, and then Poly Group donated one more. So we had 2 additional ones to give to the community. As we speak, you go to the community and realize that it is really, really useful to them. They also had a community clinic which was a bit under-resourced. We have doctors on the platform, we have friends in pharmaceutical companies and all that. So we spoke to them together last year, August. We went back to Girmay. We organized a health screening there. We donated medical equipment to them. We had pharmaceuticals that we also gave to them. And then again, we tried to offer some support to the deprived kids and families within the community by donating clothes, shoes, and some food items as well to them.
We'll be delving some more into the composition of this group. You have told us a lot more, but whether or not it's open to everybody, that's another issue. We'll come to that pretty shortly. But Girmay Haile, right? I love your name anyway. But this is what I want to find. You are with UNAIDS. How does the UNAIDS fit in this whole setup?
We fit in this whole setup because of the partnership we have been able to develop with Paddies. As you know, we have embarked for the last 2.5 years on a very wide-reaching campaign called Protect the Goal campaign. This is a campaign against on HIV prevention, and it is mainly targeted towards the youth. And in that campaign, we had adopted the possibility of working with a large number of celebrities. We work with celebrities because, one, we wanted to contextualize their messages so that people quickly pick up and empower themselves with those information. And also, we would reach a big number of people. We have about 135 celebrities that signed up on that campaign. and we're reaching close to 5 to 7 million people through that contact today. So Paddies, being an organization or a civil society, more than an NGO, civil society that brings together quite a number of celebrities and very well-known people in the areas of profession. And for us, it's a captured audience that actually is capable of transmitting the messages that we require more. But in particular with Paddies, this time around, we are working around Ebola. Okay. As you know, the threat of Ebola is still there, and that the country has to enhance its preparedness, and there is a preparedness plan that was developed by the government, which all of us have taken pieces of it and are trying to implement. And ours is mainly focused towards community empowerment in terms of preparedness for Ebola and the prevention of Ebola. And for this, we found Paddies to be a perfect partner to do this work with.
I see.
So that's why we're here together.
I see. That's good to know. But I mean, what would look at the situation we have here in Ghana, and one would say, you know, focusing so much on something like Ebola is a bit far-fetched, really. Why don't we look at the more, should I say, realistic ones? I mean, there's cholera, dysentery, malaria, for instance, quite a number of other things we can really focus our attention on and really get out of the system. So is Paddies, for instance, looking at any of these? Yeah,
well, okay, Paddies maybe may speak more into that, because he had just given a very good example of the community work that they did.
Yeah, which I think is fantastic.
Which directly now relates to campaigns on cholera and what have you, because providing clean drinking water and good health facility to a community means a lot of reduction of these waterborne diseases. And so therefore that is a very good indication. But on the other hand, if you look at what is happening in Ghana, the campaigns that are around malaria, the campaigns that are around cholera and now meningitis is a very serious campaign. But what we want to also inject into that line of information sharing is a matter of empowering community in terms of a preventive thing. Because what we talk about Ebola, for instance, we'll probably be talking about in malaria, we'll probably be talking about in cholera campaigns, because it boils down to hygiene and it boils down to looking at your culture. Sometimes some cultures are vulnerable because of the cultural traditions that they have. And these cultural communications probably may be the avenue for spreading a certain kind of disease. So Ebola falls squarely into that. And why did Ebola became so violent in West Africa? Is because of the culture, the physical culture. We touch, we shake, we hug, we do. So that has been the main reason that you had very high contacts with people. And this culture that we have and tradition that we have in Ghana is also no different than that. So I think while we are talking about the other more realistic issues, like you say, because they're attacking now, I think it's also good to include these kinds of things and move into empowering people.
That's good to know. So, Franklin, I was asking about this group and whether or not anyone can be a part of it, whether anyone who chooses to voluntarily offer himself or herself or his resources or her resources can be a part of it, and how, if so?
Well, currently, as we speak, we are in excess of 50 in terms of members, and so far, what is happening is that now some of us need to recommend, or kind of, in Paddies we say somebody needs to sponsor you to come on board. We do voluntary contributions. Periodically, we have monthly dues we pay that typically is used to fund some of these projects. Again, to add a bit to what Haile said, we also believe that the fact that Ebola and HIV/AIDS is not too much in the face now doesn't mean it doesn't exist. There is still need for us to get our people well informed, to understand the expectations, to understand symptoms, to know how to prevent it, to know how to keep yourself, healthy at all times. Because, like he said, as a civic society, we believe that if we are all healthy and we are contributing to national development, our environment, our nation will be a better nation. So, yes, that is.
Any upcoming projects?
Yes, as we speak. I mean, tomorrow by this time, I'm sure that Jamestown will be full of Paddies with canvases and celebrities. within the community of Jamestown. We are drumming home the fact that, number one, it is time for us to have zero new HIV infections. Zero new HIV infections.
It's possible.
Yes. And then number two, no discrimination, because we need to agree that, yes, some of us, unfortunately, are already victims. So no discrimination. And then number three, no AIDS-related deaths. So for AIDS, these are the three key things we want the people to believe in, to accept the fact that, yes, it is possible, and we need to make it happen. Again, like Haile said, we need to empower the people to understand these things so they become like peer checks on each other when you are going out of your way and your peer, because they all are well informed and they all understand the issues. And then on Ebola, again, this is a densely populated area. It's along the coastal belt. Mm-hmm. It is in parts of the sub-region already, and we need to be alert. We need to be sure that our environment is kept clean. We are living very hygienic lives. We are consistent on the fact that, yes, our culture allows us to have a lot of physical contact, but the risk is high, or is higher when we continue on that route. So can we avoid the physical contacts as much as possible? Can we know that at every point in time, flowing water, cleaning of hands, using soap, and that kind of thing, it should be part of our everyday lives to ensure that some of these things never hit us. And then again, in terms of management of these diseases, immediately there's a symptom. What do you do? How do you manage it? These are the kind of things that we'll be sharing with the community.
Okay, so it's tomorrow at what time?
Yes, it's tomorrow by 6 o'clock in the morning. We start at the Jamestown runabout, and we move into the communities. It's a door-to-door with the celebrities, with the medical team around.
Okay. Craig, maybe I should take your final words. Yes, I can take your thoughts on this, and then maybe your final words.
Yes, my thoughts on this is, when we look at the National Preparedness Plan for Ebola in Ghana, we see that the health sector has prepared very well, that the health sector response will be effective should we be confronted with any incidents. But the social defense has not yet been built. And epidemics usually don't happen in hospital wards. They happen among communities. Mm-hmm. So empowering communities well in advance of whatever may come in terms of information is a very, very important and also a very opportune time for us to also do that. Imagine if we don't do anything about it and we're sitting here and then all of a sudden this thing strikes. Yeah. It will be quite a disaster. Mm-hmm. The health sector will try, but then they're only reacting to what's happening instead of a defense line, to prevent this whole thing from happening. So I think that is important thing to take notice of. And second thing is on the Paddies plan, I think this is an excellent partnership that they have built. There is quite a number of other partners also involved in this. And hopefully this is a good beginning also in targeting strategic communities where there is high burden. And then on the HIV finally, you know that in Ghana we have done very well in terms of the HIV national response. New infections are on the decline, generally speaking. And in most of the high-risk populations, especially, they're really coming down. But there is one population that is not showing any difference, and maybe even there could be even an increase. And this is the urban, middle-class, professional students, people like you, people like who are in the universities and upper middle-class people. These are people who are not talking enough about HIV. These are people who are not talking enough about condom use and protection.
But these are people we assume know the risks.
Yes.
They know better.
See, knowing does not necessarily mean you're empowered.
Indeed.
Yeah, because there is an overload of information everywhere. Mm-hmm. And this is precisely why also we partner with celebrities, because we want to contextualize the message so that it is an empowering message and that people listen to it. Because among this group, the condom use is very, very low, unacceptably low, even though there are plenty of condoms around. And the will to know their HIV status on their own is almost not there. And the lifestyle that is providing them with multiple sex partners is also there. So if you're not protecting yourself, and then if you don't know your HIV status, yet still you're engaged in multiple sex partnership, that is really, really serious disaster. So we need to check this group somehow and also penetrate into this group to be able to get the messages out to them that this is where the danger is today.
Right. Many thanks for your time on News Desk, gentlemen. We'll try as much as possible to pass by tomorrow if we can. And you did hear the final words from Girmay, Haile. He happens to be the country director for UNAIDS. You also heard me speak to Franklin Soa, who is president of Paddies. That's it's an NGO now, but it's also a WhatsApp group that have undertaken quite a number of projects so far. They are beginning another one tomorrow at Jamestown. You say it starts at 6, right? 6. At Jamestown Roundabout. Yes. Okay. You're watching News Desk here on your Joy News channel on Multi TV. We're taking a break. When we come back, Emmanuel Abuajiri joins us with business.
I need 2 whole days to tell my son's wife how to keep him happy. The Vodafone to Ghana offer is just what I need.
Hello, ma.
I will pen and paper.
Yes, ma.
Me educate you on how Mabanos your pen and zama.
Yo, ma.
And a penny breakfast in Chef Webian is butter by Chumama. Nice taste.
Yes, ma.
Netai or the middle.
Yo, ma.
No, what they'll read the book of Malachi and Sanawada until you show orthopedic pillow bed.
Auntie uses too much credit.
Me use Vodafone to Ghana. I have 2 whole days to talk.
Sign up for 2 Ghana and get 2 whole days to say it all with 250 minutes to Vodafone numbers. Call 5544 to choose this package.
Bathwater should be 104 degrees Fahrenheit, not Celsius.
Vodafone, power to you.